I think we have increased the visibility of mental health, the need for mental health care, the importance of psychiatric research within the European region. And I think that we have done very well in the sense that previously in Europe there was a tendency always to look towards the United States and going to American meetings as if we could not have meetings of a sufficient standard. And I think we have done something very well in order to attract more and more young doctors to come to European meetings and see that we have a lot to contribute. Well, I think it differs in the sense that it is an international organization, but it differs from other international organizations in the sense that many of them have a focus on specific topics. It could be biological aspects or neuropharmacology or social psychiatry, whereas in the European Psychiatric Association we try to encompass all aspects. So for a clinical working psychiatrist, you will always find something of interest when you come to this meeting. I mean, there are all kinds of things, like a market, you could say. I think it depends a little upon the country in Europe in which you work. In the Ethics Committee I chair, we get reports from certain parts of Europe where they are very concerned with shortage of staff, shortage of resources, because many go and work in other countries in Europe. In other countries of Europe, some of the main topics relate to coercion, but also to that some areas there's a shortage of psychiatrists, and many feel that there's an over-administration of the profession, so there's a deprofessionalization. It is more and more run by administrators, you can say, instead of medical doctors. So this is an issue that is important, I think. I think they should attend the next Congress. In order to be updated, we have state-of-the-art lectures, we have very good CME courses, and if you're a young psychiatrist, I think you should come and be part of the early career program, because now I'm a very senior psychiatrist, but when I think back of one of the best things that has happened in my career, that has been the networking with colleagues from all other countries. So I think this is an excellent opportunity, and I think that the EPA congresses facilitates this kind of networking with having these hospitality things and special career programs. So I think they should definitely come and be part of this. Well, I want to say that I think it's extremely important that we have, you could say, a transformation, that more and more junior doctors come here, because previously very often congresses there were many very senior persons, not so many very young persons, and I think this is a very important transformation if more and more early in their career come and join international meetings.